In this video, I want to show you how to use fluidotherapy with a client. The fluidotherapy machine should be set to 113 to 118 degrees for vigorous heating. Usually we set it at about 115. You can set it cooler if you are concerned about swelling or an inflammatory response. It's important to have your client work on active range of motion in the machine during the fluidotherapy treatment. That's one of the big advantages of fluidotherapy, that your client can move during the heat. Here are some example instructions that you might give your client. So what we're going to do today is put you in this machine called a fluidotherapy machine. It's basically a dry whirlpool. And so there's stuff in here, just actually ground up corn cobs. And that will just blow around and warm up your hand, and you can move while you're in it. So first thing, we'll take the small little Velcro thing off here so we can get your hand in there. All right, go ahead and slide on in. Put this around your elbow. Nice and snug. Okay, you can scoot up a little bit and kind of get on there. There we go. Then I'm going to turn it on. And that stuff just kind of blows around in there. So go ahead and get your hand down in it. And you can move around. You can make a fist, straighten out, move your wrist around. And basically just do your home exercises that you've been doing, but do them while you're in here. After about 5 minutes, it's important to check with your client to see if it's too warm. You can bring your hand up here a little bit. You can just kind of see how you're doing. How does that feel to you? Is it too hot? Your client will be in the fluidotherapy for 20 minutes typically. It is important to remember all of the precautions and contraindications, and of course check those with your client before you put them in the modality. Here are the precautions. And here are the contraindications. At the end of the 20-minute treatment, the machine will shut itself off, or you can shut it off earlier manually if you'd like. All right, so let's kind of slide you out of here. Yeah, I can kind of shake off in there. I'm going to take this off. And then here, hold on, let's just brush this off. Back into here. There you go. Then I will take the smaller Velcro strap, put that around there, so it's ready for next time. On this particular model, you push the treatment time button to start it, and to stop it, you'll push the stop treatment button.